Hey guys, Dr. Chris Stanley here, coming at you from Bend, Oregon. I wanted to record a quick video to explain why stretching doesn't actually change the length of muscle. Static stretching, meaning like if you're just like, stretching and holding something, hamstring stretch or like a standard like quad stretch. Those static stretching was like all the jam back in the 60s and 70s and even in the 80s, and well, I guess even there's still people out there who think static stretching is actually valuable. It has actually very, very little value other than to give someone just a temporary relief of tension or maybe pain or achiness or whatever. And so if you're out there going, well, I stretch this and it feels better, like I'm sure it does, but you're still stretching that thing, right? It's not like you stretched it one or two times and then you don't have to stretch anymore because it's all better. It's a temporary fix, and most people who are out there doing their stretches, they're doing them all the time. They've been doing them for months or years or whatever because it doesn't actually change anything. It makes a temporary change, but there is no long-standing change. There's no therapeutic value to that. So what we've tried to go to is more of what we call a neural recalibration. Okay, so if someone comes to me, we'll take hamstring tightness because it tends to be the most common, right? Especially with us guys. I've met plenty of ladies who have tight hamstrings, but us guys, especially older guys, we're notorious for having tight hamstrings, okay? Now, you don't have to have tight hamstrings. Tight hamstrings is not just a rite of passage, like it's just well, when you get older, your hamstrings get tight. I'm 45 years old and I can palm the floor, no warm up. That was just straight out of the gate. I've got my buddy Timber here with me. Yep, thanks dude. I can palm the floor, no problem. I'm 45, I've had zero warm up today. So your muscles don't just have to be tight because you're older. They're tight because you're not doing anything about it. So what do you do about tight muscles? I'm going to show you. So tight muscles, it's a neurological problem, okay? Your nervous system has decided that your blank muscle, insert whatever muscle you want, has to be tight for some reason. Maybe it's improper joint mechanics, maybe you had an injury, maybe you had surgery. Something changed the neurological algorithm that your brain uses to control that muscle, all right? So one of the things that we can do to change that is a concept called Pails and Rails, okay? And this is this concept, Pails and Rails, this is Dr. Andrea Ospina and his group came up with this concept, functional range release, functional range conditioning. You may or may not be familiar with that. But anyway, so we're gonna talk about Pails and Rails. So Pails stands for progressive angular isometric loading. I'll explain that here more in a second. Rails stands for regressive angular isometric loading. Okay, so what the hell does that mean? Progressive and regressive just describe the direction of the angle we're trying to change, okay? So let's take the knee, for example, okay? So if this is me laying on the floor, okay? I'm laying on my back. This is my hip, my knee, and my ankle, okay? If I'm trying to, let's say I'm trying to get my knee to straighten. Let's say I had ACL surgery or a total knee replacement or a meniscus surgery. All of those surgeries a lot of times will end up making it difficult for someone to regain their knee extension, okay? Being able to straighten their knee fully, all right? This concept also applies to bending your knee. It's all the same. Okay, so if I'm trying to get my knee to straighten, okay, this angle right here that is the angle that I'm trying to increase. So that is the progressive side. And then we're going to draw a dotted line. That's where I want my leg to be able to straighten to. This angle, that is the regressive angle. Okay? So let's say that this is as much as I can straighten my knee, and it's because I have tight hamstrings. Okay? This amount of knee extension sucks. You can't do cool stuff with lacking that much knee extension, all right? So a pale contraction is the contraction on this side of the angle. So basically what that means, so you see me here, I'm on my back. Okay, let's go over to the table. What this would look like, let's say I can only straighten my knee this far. This is my progressive angle. So when I do a pale contraction, I'm trying to bend the knee, and I'm usually doing it against resistance. And so I'll show you guys here in a second how I create that resistance. But I'm basically trying to bend my knee, and there's different levels of pales and rails. We don't need to go into all that today, but just suffice it to say that I'm trying to contract my hamstring, because that is the muscle that is tight and is preventing me from being able to straighten my knee. So I contract the hamstring and I hold for 25 seconds. And then I go into a rail contraction. So come back over to the board here. The next contraction is a rail contraction. That is to try to close down the regressive angle. That's the angle that should be getting smaller. Because as this angle gets smaller, my knee is straightening and I'm improving knee extension. So the way that I create the regressive angle contraction is by contracting my quad. So what that looks like, so you remember my progressive contraction was bending my knee against resistance, which I'm not doing right now, I'll show you in a minute. But then as soon as I'm done with that, then I'm going to try to squeeze my quad to straighten, close down this regressive angle. That should improve my knee extension. So one 25-second round of contraction into the progressive or the pale direction, and then a 25-second contraction into the regressive or rail direction. I call that one round. And with my patients in here, just for sake of time, usually we do like 3 rounds. And we alternate progressive or pale contraction followed by a rail contraction, then another pale contraction, and then another rail contraction, back and forth for 3 rounds. The other thing about this, now that you understand that this part of the angle is the progressive angle, this little part that we're trying to close down, that's the regressive angle. What we should do as you go through the rounds, let's say you do a pale contraction, you do a rail contraction, and you gain 5 degrees of knee extension. So let's say now instead of here, my knee or my lower leg is here. Now my next pale contraction starts from there. So the pale contraction then, instead of just being from here to here, it's here to here. And then that's my new rail contraction. And then the next one, my leg is here, it's making progress. So now my next pale contraction goes from there, and the next rail contraction goes from there. And so this is how you actually change muscle length. You don't do it by just stretching. Okay, now there are some isolated situations where a long, what we call low load, long duration, so a gentle stretch held for a long period of time, like 5 minutes, 10 minutes, etc., can be beneficial. If somebody has a contracture, well, actually this will fix a contracture. If you have like really heavy scar tissue in the joint, or you had some kind of just gnarly injury, I'm trying to think. we used to say, oh, we use those kind of things for like stroke patients or, patients with cerebral palsy or some other neurological condition that's driving a contracture. But this process of Pales and Rails, this actually changes it. This is why I call it neural recalibration, because it recalibrates your nervous system, your central nervous system, your brain and your spinal cord. It recalibrates it on how to send messages to the tight muscle and to stop sending messages to tell the muscle to be tight. So the muscle will actually change its flexibility, not because you sat there and stretched it for 30 minutes, but because you changed the message coming from your brain to the muscle to stop telling it to be tight. Okay? So next video, I'm gonna actually show you what Pales and Rails look like, particularly for the hamstring, so you can kind of get an idea of what we're talking about here.